Blockchain in healthcare. The healthcare industry is currently worth over $8 trillion, making it one of the largest industries in the world. And although one would hope that a sector so crucial to the well-being of humankind would itself be immune from the inefficiencies that plague others, this is unfortunately not the case. From overprescribed drugs, misdiagnosis, and fraud, there is a near endless list of areas within the health sector that are far from perfect, and simply increasing spending levels does not guarantee better results. In fact, a 2018 Deloitte survey cited that the United States, at 16.9% of GDP in 2016, continues to spend considerably more on healthcare than comparable countries, but it is in the lower half of the Organization for Economic Cooperation and Development, or OECD countries' life expectancy rankings. 1. The answer is to re-evaluate current policies, practices, systems, and software with a view to identifying areas of improvement through innovation, and this is where blockchain comes in. Let's look at an example. Collecting and sharing data within the health sector has always been a challenge, although we have seen huge advances being made over the last decade, such as the introduction of mobile computing within hospitals, allowing physicians and nurses to both review and update patient records on the move, while the adoption of digital data management systems over their paper-based predecessors has drastically improved communications. However, many issues, such as that of securely sharing data outside ring-fenced internal networks, whilst ensuring their accuracy, still remain. So how can blockchain help? Well, one could create a cloud-hosted, globally accessible, permission-based blockchain for the healthcare industry, where patient records could be stored, accessed, and appended by healthcare institutions, regardless of their location. And due to the immutable and permanent nature of a blockchain, healthcare professionals would have a complete, accurate, and historical account for all of their patients in one easily accessible and secure system. Although with the introduction of data protection regulations, such as the EU GDPR, it is strongly recommended that you should not write sensitive or confidential PII, or personally identifiable information such as patient records, to a blockchain, even if it is encrypted. The reason for this is that such regulations require that users have more control over their data, going so far as to allow them to have their data permanently deleted should they have a legitimate reason for doing so. And as blockchains are immutable, there is a clear conflict here. But there are solutions, such as that being used by Medrec, a US-based blockchain startup. Medrec uses smart contracts created on the Ethereum platform to link patients and providers to the addresses of their existing medical records. Medrec does not store records directly, but rather encodes metadata that allows records to be accessed securely by patients, unifying access to data across disparate providers. Medrec is a great example of a practical and pragmatic implementation of blockchain technology that offers real-world benefits to its users.